We did lose it for a
says,
second.
Meeting is now streaming and live on Facebook. It did not say that before.
Okay. We are, sorry, we may have to redo that. I'm
No
so
problem.
sorry.
That's totally fine.
Still learning these nice little kinks of going digital for everything.
Yeah.
Okay. So, okay. Board member has officially said that we are definitely live now. Okay. Everyone, welcome to NATA's or Women in Athletic Training's interview with NATA's LGBTQ plus advisory committee. We are here today with Rebecca Lopez, and we are so happy that you are here with us. Can you please tell us a little bit about you and how you kind of got into this role and how much, you know, you've loved and learned from this?
Awesome. Thank you. First of all, thank you for asking us to be here. I really appreciate it. I also appreciate that former chair, Pat Aronson, passed it on to me for me to do this. I just took over the chair as chair of the committee just about a week and a half, maybe 2 weeks ago. So my name is Rebecca Lopez, as Megan mentioned. Thank you for letting me be here today. I'm an associate professor and program director of the post-professional advanced athletic training program here at the University of South Florida. Go Bulls. And I'm the chair of the LGBTQ advisory committee. I started in this role when the inception of this committee, which actually started as a task force group back in 2017, after we kind of thought about what the committee should look like or what the task force like mission or project should be. We soon realized that it really should be like a full-on NATA committee. So it was approved as an NATA committee back then, end of 2017, beginning of 2018, where I was the District 9 representative. So for those of you watching that aren't sure how the NATA committees work, there's a bunch of NATA committees, and they're basically made up of people, one representative from each district. So I've been the District 9 representative for the last few years on the LGBTQ advisory committee, and then now I'm the chair. So we have the chair and 10 other representatives on the national committee. And that's basically, we're here now. We've been here since end of 2017.
Nice. And that's, you guys are a young committee, and I can already see the impact that you guys are making. So this is like, we are so happy to have you here and to help us continue to learn and grow as athletic trainers and our patients, or for our patients and our student athletes overall.
Yeah.
So as we get started, the first thing that we want to know is, can you please give us an entry-level guide or explanation to terminology that we as athletic trainers may hear during this discussion as to best understand what we're talking about and moving forward with our student athletes or patients?
Right. So in terms of terminology, it's always changing. I always learn new terms all the time. So the key here is education. So I'm going to kind of break it down to like really simple terms. But especially if you have colleagues and patients in the LGBTQ community and you're struggling with the terminology, even after what I explained today, I strongly encourage you to go seek out more information on this. I guess there's a big umbrella term that's kind of the queer community or LGBTQ community, and I'll explain what those letters stand for. If you have any questions along the way, please cut me off, interrupt me, and let me know if there was something that's not clear. So there's two really important distinctions to make, maybe more than two, but the main ones that you heard of are sexual orientation, which is basically who you're attracted to, and then gender identity. And those are two distinct things. So gender identity is somebody's own self-identity, how they identify gender to themselves. And then sexual orientation is who you're attracted to. There's also a couple things to keep in mind. Gender expression is basically how you express gender to the world. So the clothes you wear, I'm wearing makeup, I have hair, long hair, earrings, anything like that would be gender expression. And then there's sex assigned at birth, which has to do more with biology. So your genitalia, chromosomes, hormones, and all that. So those four things, your sexual orientation, gender identity, gender expression, and sex assigned at birth or biological sex are 4 distinct things that everybody has. So if you are a a straight female that is attracted to men only and identifies as a woman, you have gender expression, sexual orientation, gender, everybody. So it doesn't matter who you are, everybody has those things. So a couple of common sexual orientations that you might have heard of is like lesbian, gay, bisexual, there's pansexual, asexual, and then the gender identities is when you're talking about people, how they identify their gender. So you hear more about the trans population or trans plus population. So in terms of the LGBTQ plus, the LGB is sexual orientation, lesbian, gay, bisexual. The T is transgender, gender identity. Q is queer, which could be an umbrella term, whereas some people also identify as queer. And then the plus is because there's so many letters. You might also see LGBTQIA, which is intersex and asexual. And the plus is basically a way to make it super inclusive. So because there's so many different gender identities and sexual orientations, that the Q plus at the end makes it a lot more inclusive. And it's hard to say all those letters also, especially as the name of the committee. So in case you're wondering what all those letters are for, and the plus it's just a super inclusive thing for anything that has to do with gender identity, sexual orientation. Does that help?
It does. It helps out a lot. And you mentioned if you're still kind of are confused, when not understanding those things, what resources do you recommend us reaching out to or looking into to help educate ourselves and to help make ourselves better understand those things?
Right. So we have a website on the NATA website. We're one of the professional interest groups. So for example, if you're in the collegiate setting, with your membership, you're automatically signed up to receive the collegiate newsletter from NATA. Whereas for this one, ours is the inclusion. So if you went to NATA professional interest groups, you look for the pink banner that says inclusion. And that is our website. We have a whole page on resources, a lot of PDF downloadables and things like that, and links to articles that you can learn more about. We also have a Twitter account. It's LGBTQ NATA, which we are always sending out resources. Just this month, because of Pride Month, we've published a lot of papers in the Sports Medicine Legal Digest, NATA News, NATA blog. So if you follow us on Twitter, you end up actually getting a lot of our resources that way. But if you sign up for our quarterly newsletter, every quarter, you'll get an email with kind of updates from the committee. Aside from that, there's national organizations like the Human Rights Campaign. There's transathlete.com, which is a great resource regarding transgender athletes. And the list goes on and on, but yeah, there's a lot out there. But we also have a lot of these listed on our website, on the inclusion website.
Perfect. That makes it easy. It's all in one space, and we're already on the NATA website pretty regularly anyways, especially coming up with convention.
Yes.
Okay, so the first thing that we have, now that we kind of have some of the basic terminology down, please tell us about the LGBTQ plus advisory committee and how athletic trainers can best utilize it as a resource.
Yeah, so anytime you have a question or anything like that, obviously going to the website is helpful. We are constantly putting out information and trying to provide resources. The mission of our committee is basically a committee for advocacy, to advocate, and for education of resources, basically so that athletic trainers can create an inclusive environment, an equitable environment, and most importantly, patient-centered care that takes into account the needs of the LGBTQ patient population. So from an advisory committee standpoint, we also advise, the NATA board of directors. We've made a lot of changes. We've also had super supportive board members, and President Lindley has been extremely supportive of us. But if you the best way is to go to the website and look who are the district representatives are. So if you have a question or you need resources in your area, it would be great if you just reach out to whoever your district representative is in your NATA district. And then they could get you in contact with resources and anything like that. There are also district level committees in some of the districts already. So those of you who are looking to be involved, you don't have to be gay or trans or anything like that. You could be an awesome cisgender straight ally that wants to be involved. And we're looking for representation of all different people in our both district and national committee. So I would reach out to people and get involved. We also have a town hall meeting, part of virtual NATA. It's going to be on Tuesday, the 14th. 3:45 Central Standard Time. It's supposed to be officially announced when we get the virtual NATA, but I know that information is coming out. So keep an eye out for that. That would be a good way to kind of know what's going on with the committee. We have some awards, educational stuff, and things like that. And you could also interact with people within your district.
Nice. And obviously with virtual NATA, once we get some of this information, we'll be sure to kind of push it out there for all the members so that they can continually get those updates and be interactive. And because that's the best way for you, I feel like personally, at least for me, is to learn and to start building those relationships and to start getting involved.
Yeah, absolutely.
How can we be better athletic trainers for our LGBTQ plus patients and student athletes?
I would say the most important part is to create an environment of inclusion. And that means, sure, you could go, your university, most public universities have some kind of safe zone, safe space training. I would encourage you to go to that. I would encourage you to get your entire staff to go to that, your team docs to go to that, coaches even. We could do the best we can within our limitations, right? Like if you're in your athletic training clinic and you don't tolerate anything that's, homophobic or transphobic or comments, jokes like that, that's awesome. But then you go out on the field and you hear things, or you have negative experiences when you refer one of your patients to a physician that might not be as inclusive in their language and things like that. So lots of things that athletic trainers could do for inclusion. And it starts with getting the education, making sure you're aware of like the latest, or at least go through some kind of training, have your staff do that. If you go to a training, for example, you get some kind of indicator that you could put up that says this is a safe space. That goes a long way for somebody to see that and be like, okay, I could talk to this person. The documentation that you use could be revised so that there's not just male, female. You might have people that identify differently, or their insurance card says one thing and their driver's license, but they identify a different way. And none of the forms that you have give them the ability to say, hey, this is the name I use, or these are the pronouns that I use. So the words that we use are really important. The forms and having inclusive options in our documentation. We document all the time as clinicians. So having inclusive documentation is really helpful. You could create non-discrimination policies so that it's not just that you have it and your staff sees it, but something that you share with your student athletes. Like, this is our non-discrimination policy. We're not going to discriminate, on the typical things you see, the typical marginalized groups like race, religion, sex, age, whatever, and then include sexual orientation and gender orientation. Sexual orientation and gender identity, and things like that. So we actually have an infographic on our website on how to. It's like a checklist of creating an inclusive clinic. So I would recommend that you check out that. It's just like a PDF that has like a whole list of things that athletic trainers could do. I mean, I could keep talking about them, but.
Yeah, no, again, the more we know, the better. And we will find that PDF and go ahead and share it within the group so that they also can start looking at it. And, we've had a lot of time with COVID to kind of adjust and make new arrangements. I think with everything going on, I think this would be another checklist for us to be and be like, all right, this is what is needed for us.
Right. And it would be really helpful, I think, starting with the education piece is, unfortunately, a lot of our district reps, we had set up to do safe zone training at our district meetings, but because a lot of them were canceled or went virtual, we weren't able to convert that. But in the future, there will be more like of the official NATA safe zone ally training, safe space ally training for athletic trainers to do. But in the meantime, you could absolutely seek out more information and education at your settings.
Perfect. What steps can educators take in order to cultivate more culturally competent athletic trainers, especially with those athletic training students who may be more, or even student athletes, I apologize, may be naive or unaccustomed to working with the LGBTQ plus community?
That's a great question. As an educator myself, this is something that we've incorporated here at USF with having some kind of safe zone training. In fact, what happened was I went to the safe zone training here at USF, which is very general, non-medical, non-healthcare professional, just terminology and things like that. And then My colleague and I kind of added what do athletic trainers need to know, kind of what do athletic training students need to know, and we kind of incorporated that. I think the cultural competence piece is so important in athletic training education, to the point where you could incorporate that to every single class. If you think about the 5 domains, all the domains of athletic training, whether it's evaluation or emergency or treatment or well-being, I shouldn't have started listing them because I don't know them exactly by heart, but you know what I'm saying? The admin part, everything, wellness and promotion. You could incorporate cultural competence, the way we talk to people, being respectful, being inclusive, whether it's sexual orientation, gender identity, or it's different races and ethnicities. The cultural competence is really important. And I think that some people are kind of scared to talk about those things in the classroom setting. And I think that we could all do better in that respect. That's something that we have, from our standpoint, our education, been like, we could have done better. Let's change some things in class and really incorporate the cultural competence piece into the classroom. And then not only into the classroom, but into the clinical education setting. So, we have a lot of diversity here, for example, in the Tampa Bay area. So we try to get our students to be able to go to different clinical sites and clinical settings, so that they are able to have those experiences as a student and learn from different people and have different patient populations that they might not have encountered otherwise. I think athletic training is a wonderful profession where you could be exposed to so many different people. Whereas if you stay in your same bubble, we tend to kind of stay with the same, growing up, the same type of friends, same everything. And then with athletic training and clinical rotations and all that, you get to kind of just be exposed to so many different people and diverse patient populations, diverse athletic trainers, that I think athletic training programs have to use that information and have to use both the classroom and the clinical experiences to help the students have more cultural competence as healthcare providers.
And kind of to follow up on one of those, what you just said is, and part of it, you said that it's really kind of a tough discussion to have in that educational setting at times. How do we help normalize that? This is obviously something that we need to work better on, and to help promote that discussion. And if it's still kind of the quote unquote taboo, and it has, if it has that kind of connotation to it, how do we help kind of make that transition into it being the standard and it being that in every educational setting?
I think education really, I always have, my answer is always education. Because I think that whenever we make jokes or we're uncomfortable, it's because we don't know and we're like ignorant about it and we just are uncomfortable with it. I spend my life talking about, LGBTQ things and taking rectal temps for heat stroke, because that's so I'm always talking about uncomfortable things. But I think that when you actually talk about them, whether it's you have a guest speaker or you just educate yourself more on the topic, it becomes less taboo and less uncomfortable. So that's why I like the training, going to a training or education like in your own setting, because there have been so many times that I've taught the safe zone or safe space ally training to students, to clinicians, to colleagues, any different, so many different groups of athletic trainers, educators. And a lot of times people are like, I didn't know any of that. And I didn't realize the things that I would say was like, that I thought were a joke, weren't really a joke. And so when you teach somebody about that stuff and they understand like, these are people and like, this is how like the words that you use really matter. I think that goes a long way. So I don't know how to make it less uncomfortable other than to just learn more about it. And that's kind of how it goes. I think with anything related to cultural competence, is just to learn, and also to surround yourself with people of diverse backgrounds, and not expect them to teach you everything about it, but basically just be around different people. And I think that's where like the diverse clinical settings and things like that kind of also helps it be a little bit something that you're more comfortable with.
Yeah, that makes complete sense. How can we as athletic trainers best support our trans patients?
Great question. I think a lot of it is understanding what being transgender is, what they're going through, what's going on with them as a person, and to the point where it's somebody whose gender identity does not match with their sex assigned at birth. So they're mentally have probably been in a tough spot most of their life, because from my experiences, most trans people knew from when they were a kid that things don't match up in their head with how their body is. So I think from a patient population, first of all, know which policies affect trans athletes, especially if you're in an athletic setting. So if you're NCAA, there's a lot of really good information on the NCAA resources. The name is escaping me of the PDF, but it is also on our website. Or they have information about trans policies, like what's allowable, what's not allowable in terms of hormones and things like that, and when eligibility for playing. The eligibility for playing, I try not to harp on too much, because that's not really important to us. What's important to us is the health and safety of that athlete. But it helps to know the policies and make sure that you're not telling them like, yeah, let's go do this, and then, or go to the doctor and do that when it's something that's against NCAA policy. So it's always helpful to know what the policy is, so that you could guide their medical treatment. Language is really important. So using their preferred name, their name that they ask you to refer to them as, using the pronouns that they ask you to use, and just being respectful and inclusive of them. And if that means not something that you had ever thought about until you have a trans athlete, I always think that happens a lot, like you learn something in school and then all of a sudden you don't really see it, and then you see it and you're like, oh, I have to go back to that, right? So if that means you create a transgender policy because of one person that kind of realizes like, we're not doing everything we need to do and this needs to be better. So seeing if there's something that you could do from a clinic standpoint in terms of non-discrimination policy. Does that person have access to bathrooms, locker rooms that they feel comfortable in, and are private, the ability to have like a private space if they need it, letting them use the bathrooms and locker rooms of their the gender that they identify, and then treating them like a person that you respect. It's really, really simple in terms of like, just be nice to them and be respectful, and if they ask you to call them by a name and use certain pronouns, do that. Privacy is also really, really important. So keeping in mind that they might have come out to you as the athletic trainer, because they tell us everything, right? As anybody that's worked with, you have your team, your group or whatever, and if they feel comfortable and they're going to tell you that means that they trust you and they feel like they could tell you that. So keeping their information private and asking them like, is this something that is private? Is this something that the team knows? Should we talk to coach about this? Whatever it is, having a one-on-one conversation, a meeting with them to see like, okay, let's talk about this. Tell me what you need. Tell me what this, basically having a really honest conversation with them about what their needs are. If they get hurt, it's going to be, just like an athlete, any of your athletes getting hurt, but if there are certain physicians that they don't feel comfortable with and things like that, those are all things that if you have like a one-on-one meeting with them with the patient, just to see what's going on with them, what they need from you, and making sure if necessary, take it to the next level of meeting with the coach, meeting with the administrators to see how everybody could be more inclusive and make sure that person is feeling welcome and included with the rest of the organization. I think those are really good things. And there was actually an article that just came out, NATA News or NATA blog, by Jen and Emma Nye on having a trans patient. So if you just Google NATA blog transgender patient, it'll come up. But it's a really great article that basically talks about that basically answers that question, but in a short article form.
Which is, I think you answered it great. And we will, again, once we find this, we'll send it out to the group so it has like continued resources, and we encourage people to continue to read up and, learn more.
Yeah. And I think that's something that's also very easy to share. So share it with an entire staff, like, whoever isn't able to watch this today, at least you could share those resources with other athletic trainers that you work with, and hopefully at least open the dialogue to talk about it and change policies and things like that. Perfect.
Yes. And so our last question right now, before we open it up and ask if anyone else has any questions, who's viewing, understanding intersectionality is key to better understanding how each of our descriptors meets up with another, and the influence it has on how we walk around in the descriptors met. I'm sorry, let me start this over. This is like a whole paragraph of a question, and I feel like I just butchered it. Okay, how can we as athletic trainers, or no, wrong question. I'm just really,
you're good.
Middle of the week. We got this. Yeah. Sorry. Okay, understanding intersectionality is key to better understanding how each of our descriptors meets up with another and the influence it has on how we walk around in the world. The intersectionality of BIPOC, so Black, Indigenous, people of color, and LGBTQ plus persons create a heavily marginalized community. How can you expand on intersectionalities like these, and how, as athletic trainers, can we further educate ourselves to provide the best care possible?
Okay, intersectionality is something that I'm so interested in, and I'm trying to read more and more about it every day. It's basically a theoretical framework of how we don't fit into, individual boxes, right? So there's different, whether it's race, ethnicity, religion, gender identity, sexual orientation, all those things, there's overlapping aspects of that, right? So it's just like saying, the women in athletic training group, you said there's like over 8,000 people. You couldn't just say all women feel like this and like fill in the blank, right? Because we're all so different, right? And we'd be mad. All of us would be mad about that. No, I'm just kidding. But so then you have people that are, for example, different ethnic minorities and female, right? So we talk a lot about women in athletic training and, whether or not we get a fair shake at, working professional sports or being treated differently because we're female in the profession of athletic training. So intersectionality is an overlap. So you have an overlap of different social determinants of whether it's race or sexual orientation, or so if you have somebody who is ethnic minority or a marginalized group, like BIPOC, person of color, and female, and LGBTQ, that's like 3 different marginalized groups that they don't happen individually. That is a person. Intersectionality basically is saying that person is having overlapping either discrimination or disadvantages because they belong to these different groups that do overlap. So it's really important. Back to your original question, I think, is what athletic trainers could do about it, I think. I saw this article out of Boston that I really like. By the way, Kimberly Crenshaw is a person who coined that term intersectionality. I just recently started listening to her podcast called Intersectionality Matters. Excellent podcast. She's also written some books, and it very, very educational, awesome. And so some of the things that they pointed out, what you could do is be aware of the fact that it is a thing, right? Intersectionality is a thing. Be aware of the space that you occupy. So I think with a lot of these things that we're hearing and things that are happening, injustices that are happening in our society for a long time, but are like super like in the forefront in the last couple months, is be aware of the space that you occupy and whether you have different groups represented. So if you have a board, for example, you have a committee, you have a board, look around the room. Are there people of different ethnic minorities represented? Are there people of different sexual orientations, gender identities represented? Because those people need a voice, right? Marginalized people need a voice. So as an athletic trainer, if you're able to include people of different diverse backgrounds and surround yourself with people of various diverse group, then you're going to be able to do a better job as an athletic trainer. You're going to be able to deliver better patient-centered care. You're going to have a better committee, group, whatever it is that you're trying to do. If you have representation from diverse people, I think it'll help just be better at what you're doing, making sure you don't have biases, or you might get called out on your biases, which is a good thing. That's another thing that we talk a lot about in terms of LGBTQ and patient care is people have implicit bias when you're not really aware that you're treating somebody. You have a bias towards people of a particular group, but you might not be aware even that you're doing it. So sometimes when you have people that are very aware or people of different groups represented, you might get called out. and that's a good thing if you're not, especially if you're not aware. And I think a lot of people recently have been called out a lot, and it's uncomfortable, but we grow and we listen, and I think that we move towards being better for everybody. So I think that that's kind of where I think from the NATA LGBTQ advisory board, we haven't talked about this enough, but that's something that, reaching out to the EDAC district representative in my area to see where there's collaborations, anywhere that different groups, different committees can get together to collaborate to make sure that we are doing the best we can, I think is a really long way to answer the question that you asked.
No, and that's perfect. And actually, so you're right. I think everyone had kind of going back is everyone's kind of, a lot of people are getting called out right now. And I think that is great because that's where we learn to grow. I actually just started reading a book called The Blind Spot, the unhidden biases that we have. And it touches right on that. And so that is a great book if anyone's looking to read to that, because you don't realize you have them until someone points them out to you. So again, I think that is, sorry, that was a long-winded answer or a question, not answer. That was a great answer to the long-winded question, and you answered it perfectly. We do have a question from someone within the group. It says, if we have an athlete or student who is questioning their sexual orientation or gender identity, who comes to us for advice, how can we be a support system for them, especially if their family is not understanding or accepting?
Great question. Know that if somebody is coming out to you, whether, you could come out as trans or come out as sexual orientation, it's like still coming out, same terminology used. Know that it's from a place of trust. They're coming to you because they trust that they could tell you that. If you don't know enough about it, I would say educate yourself as best you can and be there in a supportive role. Depending on the age of the patient, referral to mental health is always a good thing, especially somebody who is knowledgeable about these things. The last thing you want to do is I've heard of teenagers that come out, their parents find out, and then they take them to a very conservative mental health person from the church or something. And I'm not saying there's a lot of churches that are very open and inclusive, but in this particular case was very negative and was so I think finding resources where they could talk to somebody and get their questions answered maybe would be a really good thing. And then from a healthcare standpoint, do what you do, for everybody else. But from a counseling type of perspective, you might need depending on the situation, you might need to seek extra help in terms of the mental health aspect of it. But making sure that if their family doesn't know and all that, or their teammates, that that's their privacy and that you do the best you can to support them and use resources outside to help them.
Yeah, that's great. And I feel like the best learning, I personally have not gone through this process of helping or having an athlete come out to me, but I feel like many other things in athletic training, you learn most when it happens to you. Right. Kind of like you mentioned before, oh man, you learned that back in school, haven't brushed back up on that.
Yeah, exactly. I think the only difference with this, and I know I used that example before, the only difference with this is that if they don't know that you're an inclusive person and that you're an ally, that's why having the education and having the indicators up that show that it's you're an ally is a good first step. Even if you don't really know how to help them, but so that they know that you're there to help them, that you're on their side and that you want to help them. So I think doing that, and then you could learn, find the resources if it comes up or when it comes up, because it will. You've probably, everybody that's watching, I don't even know how many people are watching this, but everybody who's watching this has treated an LGBTQ person before. You have, maybe you didn't know it, but you did.
Yeah. We don't have any other questions. Do you have any additional information you'd like to share with us and the members?
I think I said a lot of things. Let me think about it. I definitely want to thank you all for this opportunity. I think it's great that you all are open to have these discussions and ability to have this information out to the group. I think it's great and it shows awesome things about this group and that willingness to learn and get the information out there. I would definitely just, again, encourage everybody to seek out the NATA LGBTQ Advisory Board's inclusion group. It's an inclusion professional interest group on the NATA website, where you could sign up for the newsletter, look at our resources page. I would say the two most important things on our inclusion page is to look at the resources. It has all kinds of information that you could share with others and learn yourself, and then also to know who your district representative is. That way you could reach out to them, let them know that you just learned about the committee or whatever it is, and then any questions you have, or if you want to be involved. I think that would be a great next step, is find somebody that's close to you. Again, people could always contact me as well, as a chair of the committee, and anybody in the committee for more information. And then I would say, if you are available on July 14th, is check out the town hall. There's going to be a town hall meeting for EDAC, and there's going to be a town hall meeting for LGBTQ. And there are different, usually when it's in person, they kind of overlap, and we have to pick which one, or go to one and then go to the other. But luckily they made it, so I don't think the official announcement is out there, so hopefully I don't get in trouble. But my understanding is that it's on 2 separate days, so you'd be able to go to both and just take it all in. If this is all new to you, just show up, be supportive, and take all the information in, and then let us know what questions you may have and how we could help you provide more resources for you as a clinician or athletic educator, whatever setting that you're in.
Perfect. Well, we want to thank you so much for taking the time out of your day to come talk to us and the members. This is a huge tool that I'm not even sure people are aware of, that this committee is available. So we want everyone to know, because like you said, we more than likely have had an athlete that we just didn't know it, or patient, whatever setting it may be in. And we see the importance, and we want to help make ourselves better so that we can provide the best care possible. And thank you for providing so many resources and information, because again, the growth starts now with ourselves and that education, and that starts here with you. And you're doing great work, and we appreciate you and all that you're doing, and just keep being great.
Thank you. I appreciate it. Thanks so much for having me.
Yep, no problem. We are going to end the live stream. Everyone have a great day, and we will see you soon.
See ya. Thank you.